I'm trying to get it set up. So Phil just did the percussions. I coughed up a lot, actually. And I knew I needed it because I was in here trying to get a nap and I was coughing up a bunch. My friend Kathy Cox, who's a radiologist and a dear friend, she said I got a lot of junk up front, so he spent a lot of time up front. And I'm just laying here to kind of show you that I'm still coughing up a lot. So, remember, once we do the percussions, you do the special breathing, okay? Because see, right now I'm not coughing if I just kind of talk regular and breathe regular, but watch what happens. We do that special breathing. Oh, one thing I did to get the deep stuff out is when I started coughing, I would let him keep drumming, and I would cough and cough and cough and cough and cough and cough and cough until I couldn't cough anymore. And then he would stop so I could suck in a big breath of air and then cough it out. That worked really well this time. I don't know that I could have done that before when my lungs and chest were so tender. Because, I mean, there's some pain involved before, you know, like, it's just too sore. Now it just kind of feels tight, like it doesn't want to open up really well, but, so I'm going to start my breathing, which is out through the mouth. And in through the mouth, small hole. Ugh. So anyway, I think that's a really good way, at least I've found, to really get that deep stuff coughed up. So that means I got 3 loogies out of that. I'm having a phlegm snack, potentially a phlegm meal, and I don't care if I'm nauseated, I don't care if I have diarrhea. I want to have air in my lungs, okay? And you do too. Right, Gibson? Come here, come here, come here. Yeah, you're a good puppy. Lay down right there. I know, it's all very scary. Don't be scared, honey. It's okay. We just gotta work through it. There's so much scary stuff going on that dogs and animals sure don't understand. Okay, here we go again. Oh, gosh, that's gross. There's so much coming up. I mean, of course it's in my lungs. Where else would it be? It's not like I'm coughing it up from my toenails. It's not coming out of my bladder. It's not coming out of my liver. The only connection between my mouth and my trachea, the only connection is into my lungs. All that crap is in my lungs. Oh, I have not had any more fevers. I do feel well. I did start on the chloroquine or whatever that's called, as well as zinc. So I'm taking 5 things now. But again, I just feel like today's a really good day. I'm taking Mucinex with a lot of water so I don't get kidney stones, and so my urine is nice and clear and I don't get real constipated. Not that constipation has been an issue because of the phlegm thing, but the phlegm meals will give you diarrhea. Okay, so there's that. Mucinex. I'm taking zinc with the, what's it called? Hydroxychloroquine. And I'm on hydroxychloroquine. I'm just taking it, I want to say, for 4 or 5 days. Got to be real careful about giving that to children. You really got to ask your doctor. I can't tell you what to do there. And certainly with anybody with heart disease or high blood pressure or heart arrhythmias, got to be really careful there. So those patients, you guys got to really get in touch with your doctor. I mean, everybody does for that, but realize this, there's a compassionate use legislation that was mandated, meaning even though it hasn't necessarily been approved for COVID-19, if that medicine has been used before safely, which it has, for lupus, rheumatoid arthritis, malaria, or anti-malaria, right? Then they can compassionately use it for this, even though they don't have all the randomized controlled trials. I don't know if it works yet. I only had my first dose 3 hours ago. Okay, so there's Mucinex DM or Robitussin DM, zinc, the hydroxychloroquine, the Z-Pak, antibiotic, assuming there's a bacterial pneumonia on top of this viral batty crap that's going on, and then Augmentin, which supplements this antibiotic. To Augmentin has some penicillin type stuff in it. So anyway, those are the medicines I'm taking, and I'm going to do my breathing again. Remember, don't assume that just because you can talk that your breathing is really good, because watch this. Embarrassing. So anyway, I even laying on my back, I can get stuff up, and then I would go to my side, I would go to my belly, I would go to the other side, on my hip, over the bed. Just drain that shit out. I'm sorry for that bad word. You guys gotta forgive me every now and then for throwing one bad word in there. Kids don't use that word. I'm just really sick and delirious. So that's it. Over and out. I love you guys. Do all your stuff. We're gonna get through this. I have no doubt in my mind that we're gonna get through this. And I know all this is disgusting, but I had a friend of mine tell me that, Missy, your COVID-19 is going to be like COVID porn. People just, it's disgusting, but they want to watch it, and they just have to watch it. So anyway, I probably shouldn't have mentioned that, but the medicines are making me pretty nauseous, so I got a bucket right here beside my bed. And now that I've done that, let's see what my thing is here. 83, and my pulse is 90. Quite a recovery. Oh, there we go. So just so you know, I'm going to show you what it is. So 97, oops, get my finger back in there. It turned off. 98 with a 99 pulse. But like I said, it's okay that your pulse is a little high and your body seems to think you're walking a lot, because think about it. It's working a lot to try to get oxygen to you. It's having to pump a bit faster because it runs down by the lung to get oxygen, and all it's finding is phlegm. So it has to run through there a couple of times. So instead of having a pulse of 50 or 60 or 70, you're having a pulse of 100. So that's another indicator that you're not oxygenating well and you have atelectasis or collapsed alveoli. Those little air sacs are kind of collapsed. So anyway, this has become my new best friend. And over and out, day 19. I'm giving you updates as I get them, okay? I just want you to have the knowledge that I have gotten through medical school, as well as through just my experience in medicine and being a mom too, you know. I mean, you get experience sitting up with babies in the middle of the night. And I just want you to know that, because, I mean, my goodness, it's already so scary to know that all these people around the globe are hurting and starving and dying and suffering. But to then be thrown all of this medical information, and for nobody to give us a home program that we could maybe, I mean, we're all sitting at home, most of us not working, even all of you working folks. I mean, I'm retired, I would have been anyway, but even all you working folks don't just want to watch the TV and the bad news all day. So doing some of these things, I think, will make a profound difference. And actually, you remember that x-ray or the CAT scan I showed you with the COVID-19 and how nasty that looked? All the white. I forget what video that was, but anyway, it had the regular CAT scan of the chest and a COVID-19. The doctor last night said he's never seen anybody 18 days out with COVID-19 having my kind of lungs. And I told him I'd been doing pulmonary toilet the whole time and been coughing up a ton of stuff, and that I thought my x-rays would look better. And he said, no, this looks amazing compared to what we've been seeing. And those patients usually show up anywhere from, I think he said anywhere from 7 to 12 days. So the fact that Phil's been doing all this pulmonary toilet on me, and I've been doing those exercises, you know, to really, when I start coughing, keep coughing till I go to the end and I can't cough anymore, air out, and then gasp that air, that breath. It's amazing how much it makes you cough out on your next cough. Really much more effective way of doing it. So, giving you all the tips and tricks as I learn them. I'm learning here too, okay? I just want y'all better, and I want us to get back to as normal as we can get back to, whatever that new normal will be. So, y'all get ready. It might be a battle for you, but you're ready for it. You can do it. I love you. Bye.